Good day. I am Reyna Nisisitu, a fourth-year nursing student from Negros Oriental State University. In this video, I will be sharing with you about my hypothetical case presentation about abdominal aortic aneurysm. Introduction. An abdominal aortic aneurysm is a localized swelling and bulge in the lower part of the aorta due to weakening of the vessel wall. As the blood passes through the weakened portion of the vessel, it dilates or bulges, and if this continues, it can rupture, which can be very fatal, leading to internal bleeding, organ damage, and even death. The aorta is a major blood vessel which is responsible for supplying blood to the body. As the aorta is the main supplier of blood, a ruptured abdominal aortic aneurysm is a potentially life-threatening condition and can cause some serious bleeding. Many of the slow-growing and small abdominal aortic aneurysms do not rupture. However, the fast-growing and large abdominal aortic aneurysm may rupture. Treatment depends on the size and the rate of the growth of the aneurysm. Treatment varies from watchful waiting to emergency surgery. Once an abdominal aortic aneurysm is detected, the doctors closely supervise it so that emergency surgery can be done when and if required. Surgery done on an emergency basis for a ruptured abdominal aneurysm can be quite risky. Clinical data. Graphic data, the name of my patient, GBD, 65 years old, address Moises Padilla Negros Occidental, birth date December 21, 1960, birthplace at Canlaon City, Negros Oriental, contact person, wife is BD, sex male, marital status married, nationality Filipino, religion Roman Catholic, educational level high school level, occupation driver, health insurance PhilHealth, source and reliability patient 70%, significant others 15%, patient charge 15% reliable. And date and time of admission December 23, 2020 at 10 a.m. Attending physician Dr. Tan. Final diagnosis abdominal aortic aneurysm. For anatomy and physiology.
The cardiovascular system is part of the circulatory system that circulates blood. The circulatory system also includes the lymphatic system, which circulates lymph, but the terms circulatory system and cardiovascular system are commonly used interchangeably to describe blood circulation. The cardiovascular system consists of the heart, blood, and blood vessels. The heart is essentially a pump that moves blood through the vessels. It has two sides, each of which has two chambers. The best-known function of the circulatory system is perhaps the transport of inhaled oxygen from the lungs to body's tissues and removal of carbon dioxide in the opposite direction to be exhaled. Basically, oxygen-poor blood from the body returns to the right side of the heart, where it is pumped to the lungs. In the lungs, blood picks up oxygen and releases carbon dioxide. Oxygen-rich blood then returns to the left side of the heart. This part of the system is called the pulmonary circuit. The left side of the heart pumps oxygen-rich blood to body's tissues, where it unloads oxygen and picks up carbon dioxide. The resulting deoxygenated blood again returns to the heart's right side to complete the cycle. This part is the systemic circuit. Because the heart's left side has to pump blood to the entire body, it has much thicker muscle than the right side. There are 4 valves which serve to ensure one-way blood flow through the heart. Oxygen-poor blood flows from right atrium to right ventricle to pulmonary arteries, while oxygen-rich blood moves from left atrium to left ventricle to the aorta. The heart is enclosed in a double-walled protective sac called the pericardium. The pericardial cavity contains a fluid which serves as lubricant and allows the heart to contract and relax with minimum friction. The heart wall has 3 layers. The outer layer, epicardium, lines the pericardial cavity. The inner layer, endocardium, lines heart chambers and valves and is continuous with the endothelium of blood vessels. And the thick middle layer, myocardium, is the muscle tissue responsible for the beating of the heart. The contraction of the heart muscle is initiated by electrical impulses, known as action potentials. Unlike skeletal muscles, which have to be stimulated by the nervous system, the heart generates its own electrical stimulation. The impulses start from a small group of cells called the pacemaker cells, which constitute the cardiac conduction system. The primary pacemaker is the SA node. It initiates all heartbeats and controls heart rate. Apart from transporting gases, the blood also supplies body's tissues with nutrients and removes metabolic wastes. It receives nutrients from the digestive system, where digested substances are absorbed through the walls of the small intestine into the bloodstream. These substances are then passed through the liver to be screened for toxins before joining the general circulation. In tissues, nutrients are exchanged for wastes. Wastes are then filtered from the blood in the kidneys and removed in urine. The blood also carries hormones from endocrine glands to target organs and plays an important role in the body's immune defense. The blood has two main components, a clear extracellular fluid called plasma, and the so-called formed elements, which include red blood cells, white blood cells, and platelets. Red blood cells transport oxygen and carbon dioxide. White blood cells participate in various defense mechanisms against invading organisms, while the platelets are responsible for blood clotting, minimizing blood loss during an injury. The blood circulatory system is a closed loop, meaning the blood itself never leaves the vessels. Instead, substances diffuse through the walls of blood vessels to move to and from the surrounding tissues. Vessels that move blood away from the heart are called arteries, while those that bring blood back to the heart are veins. Arteries usually carry oxygenated blood, while veins carry deoxygenated blood. For pulmonary arteries and veins, however, the reverse is true. The usual route of blood flow is heart to large arteries, smaller arteries, then even smaller arteries, called arterioles, then smallest blood vessels called capillaries, where the exchange of substances takes place. Blood then collects into small veins called venules, then to larger veins, and back to the heart. Arteries and veins essentially serve to conduct blood. Their walls consist of 3 layers. An outer layer of loose connective tissue serves to anchor the vessels to the surroundings. A middle layer of mostly smooth muscles allows the vessels to constrict or dilate, regulating blood flow. And an inner layer consisted of thin squamous endothelium separated from outer layers by a basement membrane. In general, larger vessels have more connective tissue and smooth muscle. In addition, arteries have more muscles than veins because they carry blood away from the heart and must withstand higher pressures generated by the beating of the heart. The walls of capillaries, whose function is to exchange substances between the blood and surrounding tissue, consist solely of a thin endothelium with its basement membrane, thus permitting easy diffusion of blood solutes.
Discussion of the disease process.
Your blood vessels are the transport system that carries blood to and from your heart to the rest of your body. Usually, everything runs pretty smoothly with this system, but sometimes there can be a problem. For example, one of the large blood vessels that supplies blood to your abdomen and lower body can swell up or bulge. This bulge is called an abdominal aortic aneurysm, and it can be pretty serious if it breaks open or ruptures. Let's talk about abdominal aortic aneurysm. This is the descending aorta, one of the large blood vessels that sends blood to your abdomen and legs. Over a period of many years, this blood vessel can start to bulge. Although doctors aren't sure exactly what causes an aneurysm, they do know that it's more common in males over 60 and people who are overweight, who smoke, or who have high blood pressure or cholesterol. Eventually, if not treated, the aneurysm can pop open or rupture and spill blood into your abdominal cavity or into the wall of the artery. If an aneurysm ruptures, it's considered a true medical emergency. So, how do you find out if you have an aneurysm? You may not realize that you have one because often aneurysms don't cause any symptoms until they rupture. An imaging test, like a CT scan or ultrasound, may help in finding a suspected aneurysm. If it does break open, you may feel severe pain in your stomach. That pain may spread to your groin, buttocks, or legs. You could also feel sick to your stomach, have clammy skin, and your heart may beat faster than normal. If you have any of these symptoms, see your doctor, who can examine you. Your doctor may also recommend an imaging test to see for sure if you have an aneurysm. Treatments for aneurysms vary depending on how severe the aneurysm is. If you're not having symptoms and your aneurysm is small and hasn't broken open, your doctor may suggest just checking it every 6 months to make sure it doesn't get bigger. If it's bigger than 2 inches, you'll probably need to have surgery. The goal is to perform surgery before complications and symptoms develop. The surgeon will replace the damaged bulging section of blood vessel with a section of man-made vessel, commonly called a graft. It's better to avoid getting an aneurysm than to have to treat it. Eat a healthy diet, watch your cholesterol and blood pressure levels, and quit smoking to help prevent an aneurysm from forming in the first place. Men who are over the age of 65 and have ever smoked, or who have a close relative who's had an abdominal aortic aneurysm, should have one screening ultrasound done to check for an abdominal aortic aneurysm. If you're having any symptoms of an abdominal aneurysm, like severe pain in your belly or back, it's very important that you get medical help right away. Go to the emergency room or call your healthcare provider for immediate help. Small aneurysms are easy to treat with surgery, but once they get larger and rupture, they can be life-threatening.
For our nursing health history. Chief complaint. Patient has been complaining of abdominal pain. History of present illness. 2 days prior to admission, patient complains for having lower abdominal pain. The pain felt coming back and forth, which he rates as 6 on a 0 to 10 scale. He was rushed to Isabela District Hospital and he got referred to Metro Bacolod Hospital Medical Center for further treatment. Current health status. Patient was awake, alert, coherent, oriented to time and place and person. Past health history, childhood illness, had complete immunization during his childhood, had incidents of chickenpox, mumps, or measles as claimed. Common illnesses as a child are cough, colds, and fever. Hospitalization, patient claimed he was hospitalized last 2017 at Isabela District Hospital for the same complaint. Serious injuries, no histories of any serious injuries as claimed. Serious or chronic illness, claimed to have hypertension. Allergies, no history of food allergies as claimed. Travel history, no travel history outside the country as claimed. Heredofamilial disease, his father has hypertension and congestive heart failure, while his mother is also hypertensive at the same time has diabetes mellitus, no other heredofamilial disease as claimed. For growth and development. For Erik Erikson's psychosocial development theory, so generativity versus stagnation. Generativity refers to the making your mark on the world through caring for others as well as creating and accomplishing things that make the world a better place. Stagnation refers to the failure to find a way to contribute. These individuals may feel disconnected or uninvolved with their community and with society as a whole. So the patient meets this stage because he is inspired by his family who is always showing full support towards him. He is contented on how he helped his family and other people. His job as a driver helps him and his children reach a brighter future and their success as individual. For Sigmund Freud's psychosexual development theory, my patient belongs to genital stage, so full sexual maturity, function, and development of skills to cope with the environment. Genital stage, which begins during puberty but lasts throughout the rest of a person's life. During this stage, it is a time of adolescent sexual experimentation, the successful resolution of which is setting down in a loving one-to-one relationship with another person in our 20s. Sexual instinct is directed to heterosexual pleasure rather than self-pleasure, like during the phallic stage. The goal of this stage is to establish a balance between the various life areas. So, the patient met this stage because he has successfully achieved this part since he has already found the love of his life, his wife. He balanced his life for his family, work, and environment around him. He has a supportive family and is motivated to work because he loves his work as a driver.